So for the classes of drugs used in treating peripheral vascular diseases, we'll be having it this way. Classes of drugs for what? Peripheral vascular disease. We said that peripheral vascular disease are basically any disease affecting arteries and veins of, it could be arteries or veins, right? Of the upper limb, of the lower limb, and the rest of that. Okay, so classes of drugs for peripheral vascular disease. So basically, there could be narrowing in the arteries. For veins, there could be vein varicose, all right? And how do they put it? The uh, the valves basically lose their competence, so you have blood flowing in the vein forth and back. Okay, so all those problems. You could see for the arteries, there's buildup of what? Atherosclerotic plaque. And this atherosclerotic plaque is basically like there's buildup of fat on the walls of the artery, so it's basically like narrow the artery down. Okay, so classes of drugs for what? Peripheral vascular disease. You will have vasodilators. Okay, because the space, how will I put it? The space is being narrowed. So you want something that is basically what? Increasing the size of the artery, okay? You could use drugs such as what? Calcium channel blockers, that's antagonists. And these ones, they will basically what? Inhibit constriction, all right? And you can use drugs like what? Nifedipine. You could use adrenergic antagonists. These are the ones that are basically feeding up the receptors for sympathetic nervous system neurotransmitters, right? So now the sympathetic nervous system neurotransmitters will not have a place to actually fill up, right? So therefore inhibiting the action of the sympathetic nervous system, all right, which will be what? Fight, fright, and flight, all right? And drugs you can use is what? Praxosine and tolazoline. Then you could use what? Beta adrenergic agonists, all right, like what? Isuzuprin. Okay, they could use antiplatelet and anticoagulant. Let me explain this. Antiplatelet is basically anything that will stop platelets from aggregating. All right, then anticoagulant is anything that will stop your blood from clotting. All right, so as the blood is flowing sluggishly, you don't really want it to clot, right? So examples of drugs you can use for this is what? Most popularly what? Heparin, then followed by what? Warfarin, then aspirin, then clopidogrel. Okay, all these drugs are what? Antiplatelet and anticoagulants, right? So this is let's have this definition, although it's not really clear, but it's meaningful. They said that vasodilators widen blood vessels, mainly arterials. Okay, and it results from a relaxation of the smooth muscle cells, which allow blood to flow more easily and cause blood pressure to drop. Okay, then anticoagulant to slow clotting of blood. Antiplatelet will keep blood clots from forming by keeping blood platelets from sticking together. All right. So anticoagulant is basically like the whole blood, while antiplatelets is focused on the platelets. All right. You could have some miscellaneous drugs or miscellaneous agents like what? The statins, like the fluvastatin, the atorvastatin, the pentoxifilin. Then you have the naftidofuryl oxalate, then silostazole, okay, then xanthanol nicotinate. All right. So all these drugs can be used to basically what? Treat uh, conditions that have to do with peripheral vascular diseases, right? Deposition of low density lipoproteins in um, blood vessels, then narrowing the blood channel, then all those stuff. Okay, so that's it about these classes of drugs used for what? Treating peripheral vascular diseases. See you guys pretty soon.